welcome back to Know Your Health Tuesdays with me, Dr. Lesego from Blue Heart Medical. We have a few questions today that I'm quite excited to answer. The first question is, can a beard cause an infection? So there are infections that can occur to men who have beards. It's important to keep your beard clean. You can get bacterial and fungal infections from having a beard. There is something called tinea barbae or barber's itch. It is actually a fungal infection or ringworm on the skin under the beard. So it can occur on the neck, the chin, or the upper lip. So it can be caused by sharing of razors. It can be caused by touching somebody with the infection and then you touch your own face. It is important to keep your beard clean and dry. So after maybe exercising or a heavy sweat, make sure you maybe you wash your beard, make sure that it's clean and dry, because a fungus loves a warm, wet environment. And obviously under the beard, it is dark and warm and wet. So if your beard is clean and dry, it decreases the risk of this tinea barbae or this skin fungal infection or ringworm of the skin under the beard. You can treat it with a cold compress if it is really inflamed and infected. So you just put maybe a cold cloth and press it on the lesions. You can also use over-the-counter antifungal creams. It should work within 1 or 2 weeks. If it's not cleared up within 1 or 2 weeks, please do consult. So you can come through and we can give you the oral antifungal treatments. There is also something called folliculitis, which is inflammation of the hair follicles. And you can also get razor bumps. So that's quite common in people of African descent with coarse, thick hair, or people with coarse, thick hair. So both this tinea barbae, which is the fungal infection, and the razor bumps, common in people with very coarse, thick hair. Men of African descent or people with very coarse hair, it's not recommended to have a close shave because you do have a risk of ingrown hairs, which is what causes the razor bumps. So you can trim your beard, make it quite short, but try and avoid a close shave because it increases the risk of having razor bumps. There is treatment, obviously, that we can prescribe for razor bumps. You can come through and we'll prescribe that for you. Our second question, are there any long-term effects of getting a vasectomy? Okay, so there are effects to every surgical procedure. None of them, I think, are without risks. So the short-term effects would include swelling or change in the scrotal color from bruising in the area, surgical site infection, pain, inflammation of the epididymis. So those are the basic known side effects, although most side effects of vasectomy are rare, it must be noted. So the long-term side effects include chronic pain. So 1 to 2% of people will have chronic pain after vasectomy. So it's recommended that if you already have chronic scrotal pain, it's not recommended that you get a vasectomy. But I think you can discuss that with your urologist and see what your options are. There's also a risk of sperm granulomas. So because the vas deferens that transports the sperm is cut, then the sperm don't have anywhere to go, and sometimes it can actually leak out and cause sperm granulomas. So it's small little balls that form, which is basically clumps of sperm. Some people would feel some balls and they don't feel anything else. Usually it's not a major issue. In rare cases, it may have to be surgically removed and it may be painful. But again, this is very, very rare. And they can sperm granulomas can increase the chance of a failed vasectomy. So that's another long-term complication of a vasectomy. It may fail, so the vas deferens may actually heal itself, and you may actually find that in the semen there is a positive sperm count. So after a vasectomy, they would usually test the semen and make sure that there is no sperm in there, so it should have a 0 sperm count. But over time, if the vas deferens heals itself, you may actually find sperm in the semen, which is obviously a failed vasectomy. Our next question, are there any home remedies you can recommend to manage pain and alleviate some of the symptoms? So there are numerous home remedies you can do to manage pain. It really depends on what the pain is, where the pain is. I mean, we wouldn't treat cancer pain the same way as we treat a toothache, for example, or wouldn't treat muscle pain the same way we treat abdominal pain. So it really depends on where the pain is. I would recommend that you do consult your doctor so that we can determine, or you can come through to Blue Heart Medical so we can determine what the pain is, what the cause of the pain is. Especially if you have chronic pain, please do come through and consult. It's important that we get to the underlying cause of what the pain is, okay? So it's unfortunately not one size fits all, so I can't just give you a list of things. I mean, I can give maybe one example. Castor oil, topically applied, has been found to reduce joint pain and muscle pain. So you actually apply it to the skin. That's just one example, but again, it really depends on the pain, and I would recommend that you do consult and come through. Let's have a look and see what the issue is. There is another question on the difference between endometriosis and adenomyosis. Very interesting question. I will be tackling that next week. So those ladies who have heavy menses or heavy menses pain, a lot of menses pain, or even if it's your family members, sisters, mothers, wives that have this pain, tune in next week and we will be addressing this question. Until then, keep well and keep healthy.